Activity after a knee replacement is much more difficult than a hip replacement. Good advice is to get up and walk every single hour. Just do a few steps that you're awake throughout the day. Be sure to use a walker or an assistive device until you're completely comfortable on your feet. When you leave the operating room, your knee will have full range of motion, meaning it goes from full extension all the way to full bend or full flexion. Your body will start to form scar tissue as soon as you leave the operating room to try and take that motion away. The best way to fight that is every hour that you're awake, fully straighten your knee and bend the knee to 90 or 100 degrees. In the first 2 weeks, you can bend the knee too far, meaning I don't want you to pull your heel back all the way to your butt and bend to 130 degrees. You can damage the incision or the capsular closure by doing that. All I want you to do is bend the knee to 90 or 100 degrees and make sure you get it out fully straight. When you're walking, it's important to practice heel-toe walking, even from the very beginning. Get that heel on the ground and fully straighten the leg with each step that you take to ensure that you don't develop what's called a flexion contracture that would require you to limp in the future to walk. I recommend that you ice 20 minutes on and 20 minutes off all throughout the day. Also, elevation is critical. When you're elevating the leg, it's important not to put anything underneath the knee, leaving the knee in a bent position. Instead, put pillows underneath the heel and keep the leg elevated in that position so that your leg is out straight, allowing gravity to push that leg straight and keep you from developing any scar tissue contracture. A day or two prior to your surgery, I'll call in your post-operative medications. This is for convenience so that you can pick them up and have them at home and don't have to go to the pharmacy directly after surgery on your way home. However, all of these medications are, again, for after surgery. Please do not take them prior to surgery. The first medicine that you'll typically get, unless there's certain circumstances, is baby aspirin twice a day. This is for blood clot prevention. It's to be taken morning and night for 5 weeks. It's not for pain or any other purpose. The second medication you typically get is an antibiotic. This is morning and night for 7 days, and again is to be taken until it's gone. I give you 14 tablets. The third medication is typically an anti-inflammatory, Celebrex or meloxicam or ibuprofen. This is great for swelling, pain, and inflammation. The last 3 medications are your pain regimen. These are divided up into mild, moderate, and severe pain, and for each of those I have Tylenol, Tramadol, and oxycodone. Tylenol is good to be taken around the clock for the first few days until you understand what your pain is like, what your pain levels are like. I like you to have something in your system at least, and Tylenol is a low-risk drug that is very effective. The second medication for moderate pain is Tramadol. This is a very, very lightweight narcotic. I tell patients that 1 Tramadol pill is a 30th of an oxycodone pill, so it's a very small amount of painkiller, but when you combine it with Tylenol and the anti-inflammatory, it's actually very effective. The last medication, the oxycodone, is for severe pain and should be reserved only for really truly severe pain. The goal of breaking up all these medications individually and having so many different medications is to avoid taking as much of this narcotic pain medication as possible. Oxycodone is addictive, it's respiratory suppressive, it causes nausea, vomiting, constipation, and a myriad of other problems.